So what happens usually is that when I'm talking to learned people, or any the layman, and I tell about head and neck, they are usually unable to comprehend what this term includes. So what would you have to
Oh,
say about head and neck cancer, sir?
oh, well. So, there are two questions in one question. One, that you are specialized in head neck surgery. You're a head neck cancer surgeon.
Yes, sir.
I am a surgical oncologist.
Yes, sir.
I deal with all parts of the body, beginning from head and neck to chest to every part of the
Yes.
body.
Yes.
You deal only with head neck surgery. Now,
Yes.
what is head neck cancer?
Yes.
Head does not mean the
Brain.
brain.
Exactly.
Head and neck means the face and the neck. Now,
Yes.
what all parts are there? Oral cancer is there, salivary glands are there, thyroid is there, lymph nodes in the neck are there,
Sinus.
submandibular gland there, sinuses are there, and skin cancers are there.
Yes.
So
Exactly.
all this is head neck cancers. So we both deal with head neck cancer. I deal also with
With
the rest
surgical.
of the
Yes.
body. So I'm a surgical oncologist. Now, what do I say about head neck cancer? Head neck cancer, major portion of the head neck cancer is oral cancer.
True.
The commonest is oral cancer. Why in our part of the world? Because of tobacco.
Tobacco.
In the
That
rest,
also chewing more than
chewing
smoking.
more than smoking, but I would say smoking is, I mean, tobacco
Equally
in any
in
which
form.
form is
Absolutely.
poison.
Absolutely.
In any which form is poison. And if you mix whiskey with it, if you're a drinker also, then it's not, say, whiskey multiplied by tobacco.
True.
No, it's tobacco square root. It becomes exponentially
Increased.
risky
Absolutely.
if you are a smoker as well as a drinker. So, oral cancer is the commonest in our part of the world, but in the rest of the world, where tobacco is now being banished into the background, so the rest of the head neck cancers are becoming more and more
And
prominent.
also, sir, the third most common cause of developing cancer is passive smoking. That's so much
So,
more
yes, if you are a
rampant.
smoker, then I am also at risk.
Absolutely.
So, if
Equal
somebody is
risk.
a smoker, his family is also at risk.
Absolutely.
So that is there indeed. So the other cancers are thyroid cancer, salivary gland cancers, skin cancers. But I think the focus in India should be oral cancer. And
True.
oral cancer comes up as an ulcer. And it's most easy to diagnose in the very beginning, in the very first
It's
stages.
visible.
मुंह के अंदर जख्म हो गया है, go to a doctor, show it. Particularly if you are a smoker, if
Yes.
you're a tobacco exposed gentleman. So go to a doctor, and if we find the ulcer in its early stages, is eminently curable. Is a very
True.
little surgery is required to remove it. No chemo, no radiation, nothing is required.
True.